Hey everybody, Dr. Rob here. Question of the day, or question of the week, if you will. Interesting. Someone said, I take omega-3s, EPA and DHA, but is there a difference and what's the ratio? So the answer to your question is, standard ratio if you're just taking a fish oil would be EPA to DHA in a 3:2 ratio. If you're going for inflammation, upregulate or take more EPA. If you're going for cognition and cell membrane health, more DHA. So what's really the difference? Well, EPA is actually a smaller molecule. It's less double bonds. And with that being a smaller molecule and less double bonds, it actually affects some different enzymes in the body. Essentially, it blocks something called arachidonic acid. Arachidonic acid is what we call poison. It's poison in the general body. It's very inflammatory. So EPA actually blocks the release of arachidonic acid and has some other enzymatic effects. So EPA is anti-inflammatory via anti-inflammatory pathways. DHA, its counterpart in fish oils, is bigger. It has more double bonds. It's fluffier. Essentially, that works at the cell membrane. So we have cells, have cell membranes. DHA gets to the cell membrane and makes it fluffier and bigger and makes the cell membrane healthier. Where is this most pertinent? This is most pertinent in the brain cell membrane. So if you want to avoid inflammatory markers going to the brain, EPA. If you want to help the cell membrane in the brain, DHA. So that gives me to the next question that somebody asked me and followed up and said, what's the difference between omega-3, omega-6, and trans fats? So we all know that omega-3s are anti-inflammatory. Omega-6s mostly are pro-inflammatory, and trans fats are bad. So the example I always like to use is, think of the arch of aorta over here. It bifurcates millions and millions of times. So think of a blood droplet. As the blood droplet comes and hits the arch of aorta, if you've got an omega-3 with DHA and it's nice and fluffy, it bounces really high. It bounces and bounces and bounces, and eventually will go down one of the bifurcations, and you'll have blood and it'll be healthy. Omega-6 makes the cell membrane stiffer. By making it stiffer, the bounce is smaller, and it's conceivable that it'll stop bouncing and not go to the left or right and down one of the alleys, if you will, and start to plaque. Trans fat makes the cell membrane stiffer yet, makes it smaller and stiffer, and doesn't allow the blood to go anywhere, and definitely plaque. So cell membrane health is a key component to overall health, not just in the brain. So omega-3s, I recommend EPA and DHA in a 3:2 ratio. Always yours in health, Dr. Rob Silverman.